In this week's Cardiology Countdown, we have several very interesting publications. At the number 3 spot is the full publication in the New England Journal of the PARTNER trial. And this component looked at the surgical versus transcatheter replacement of the valve for aortic stenosis. As was reported at the recent meetings, the outcomes for mortality were trending lower early, but similar ultimately, and meeting the non-inferiority criteria for the transcatheter valve implantation as compared with surgical valve replacement. Now, there were interesting differences with a higher risk of stroke by 1 year, about 5% versus 2.5% for the transcatheter valve versus surgical. But there were conversely more bleeding complications and new onset atrial fibrillation with the surgical patients. And so some differences in the comorbidities and other non-fatal outcomes. But this introduces really a big new option for treatment of severe aortic stenosis. At the number 2 spot is a very interesting paper in the European Heart Journal that used cardiac magnetic resonance imaging, or CMR, to estimate the pulmonary vascular resistance. Now, this is something that's currently done with the right heart cath, but if it could be done non-invasively, might expand its utility in managing patients with pulmonary hypertension. This was done with very careful measurements of the right ventricular volumes, ejection fraction, the pulmonary artery flow velocities, areas, and cardiac output. And from that, the investigators derived a formula to estimate the PVR. And so I think a useful new tool to measure a very important medical problem that has many different medical treatments currently available. Now, this week's number 1 spot is a paper in JACC that's published from the MADIT-CRT study that links up CRT remodeling of the ventricle and the risk of ventricular arrhythmias. So it's a really interesting analysis that found that the good responders to CRT had the lowest risk of significant ventricular arrhythmias, and it was a graded response, and it tracked with the amount of remodeling. It makes very good sense, but it illustrates yet another benefit of CRT, not just remodeling the ventricle and improvement in heart failure symptoms, but also reducing the risk of significant ventricular arrhythmias. So with this week's Cardiology Countdown, I'm Chris Cannon.